You hear it all the time, right? Our hospitals are under pressure. But who exactly are the patients they're caring for day in and day out? Today, we're going to use data from all across Canada to build a really clear picture of the typical patient on a general medicine ward. And in doing that, we'll start to understand the incredible challenges they pose to our healthcare system. This quote right here, it really nails it. You could say it's the whole point of this explainer in a single sentence. Over the next few minutes, we're going to dig into what those words, older, multimorbid, and diverse, actually look like when you put hard numbers from major Canadian studies behind them. So, to build this portrait, we've got to start with the fundamentals, right? The basic numbers. And the most obvious place to begin is with age, 73. Let that number sink in. That is the median age of a patient on a general medicine ward. And get this, that's not just a random number from one hospital. We see it in a major Toronto study, and we see it again in a massive study covering all of Ontario. When different studies land on the exact same number, it tells you we're looking at a rock-solid nationwide pattern. But here's where it gets really interesting. Because that median age, it doesn't tell the whole story. Not even close. The sheer range of ages is what's so telling. I mean, look at this. More than a third of patients are over 80 years old. But at the exact same time, almost 30% are younger than 60. So you see, it's not just a place for the very old. It's caring for a huge spectrum of adults. Now, check this out, because the story gets another layer when we look at who's actually providing the care. This data from British Columbia shows something fascinating. While hospitalists and family doctors are caring for an older group, right around that 71-year-old mark, the patients seen by internal medicine specialists are, on average, a full decade younger. What does that tell us? It suggests that different specialists are tackling different kinds of complexity. Okay, so we've got age down. Now let's add the next critical piece of the puzzle. And this is where things get, well, really complex. We're going to talk about something called multimorbidity. So what is that? It's actually a pretty simple idea. Multimorbidity just means a single person is living with two or more chronic health conditions at the same time. And this concept is absolutely key to understanding the patients we're talking about today. 6. Your average patient is juggling 6 coexisting health conditions during one hospital stay. Just think about that for a second. A doctor isn't just treating a single problem. They're trying to navigate this incredibly complex web of 6 interconnected issues all inside one person all at the same time. So what does that web of conditions actually look like? Well, it's a lineup of really common, really serious chronic illnesses. More than a third of these patients have high blood pressure, another third have type 2 diabetes, and then you layer on things like atrial fibrillation and heart failure. Each one of these makes it that much harder to treat whatever new problem brought them to the hospital in the first place. And this is where you really see how it all just snowballs. For these patients, having just one big illness is almost unheard of. It's the exception, not the rule. Look at this. If a patient comes in with diabetes, there's a 76% chance they have at least 2 other chronic problems on top of that. And for a stroke patient, that number jumps to an incredible 92%. All right, so let's recap. We have an older patient who's juggling, 6 chronic conditions? So you have to wonder, what's the thing that finally tips them over the edge? What's that one acute event that actually lands them in the hospital? Well, it turns out the top 5 reasons are all serious and probably familiar conditions: pneumonia, heart failure, COPD, urinary tract infections, and stroke. These are the acute crises that push an already fragile person into needing hospital care. And it should come as no surprise that these are also consistently among the most costly reasons for hospitalization in all of Canada. And just like we saw with age, why you get admitted can depend on who you see. Back in BC, we see that hospitalists and family doctors are most often treating things like COPD and pneumonia. But for the internal medicine specialists, the number one diagnosis is arrhythmia, a heart rhythm problem, which tells you they're often handling more of the specialized cardiac emergencies. And this right here, this is the real takeaway. It doesn't matter if we're looking at data from Toronto, from BC, or a massive study covering all of Ontario, the same story pops up again and again. Pneumonia, heart failure, COPD, they're always at the top of the list. This isn't just a big city problem or a regional quirk. This is a national reality. Okay, so let's pull back for the big picture here. We've gone through all this data. So what? Why does this detailed portrait we've just painted matter so much? You know, one of the most striking things in the data is that this level of clinical complexity, well, it's a great equalizer. It cuts across everything. It doesn't matter what neighborhood a patient lives in, their income, their education, or their background. This is a universal challenge that hospitals in every single community are facing. So you can almost map out the journey for a typical patient, and it looks something like this. It's a story that unfolds over decades, managing that growing web of chronic conditions. Then the tipping point hits, an acute illness, like pneumonia. That's what leads to the hospital. And that's where the real challenge kicks in for the medical team. How do you treat that one new crisis while safely managing all those other long-term issues? So, to bring it all home, the picture we've painted is crystal clear. The typical patient in general medicine in Canada is older, they're managing that complex web of chronic illnesses we talked about, and they only arrive at the hospital when a serious, acute problem finally tips them into crisis.
And all of this leaves us with one big, critical question. The data has given us this incredibly clear and consistent portrait of the modern hospital patient. Knowing what we know now, we have to ask ourselves, is the healthcare system we have today actually built for the patient of today? And maybe more importantly, is it ready for the even more complex patient of tomorrow?